Hello, my name is Chris Hill, and I'm here today to talk to you about atrial septal defect. So, atrial septal defect is a congenital heart disorder. It's a result of a malformation of the septum during development, and it results in a hole between the upper chambers of the heart. Um, Similar to patent foramen ovale, the foramen ovale, as we know, is a shunt to bypass the lungs in the fetus as they're receiving oxygenated blood from the mother and the placenta. So they don't need their lungs. Obviously, the patent foramen ovale should close sometime weeks or months after birth, and if it doesn't, there can be issues. Atrial septal defect encompasses the foramen ovale and the septum as a whole. So as we see here, blood should flow through the right atrium and right ventricle out through the lungs, and then return and be ejected via the aorta. In atrial septal defect, the blood flows through the right atrium and ventricle towards the lungs, but on return from the lungs in the left atrium, it's allowed to pass back into the right atrium where it mixes with deoxygenated blood. This can result in pulmonary hypertension. Which is in approximately 9 to 35% of cases. So along with being inefficient, another serious risk is many blood clots, micro blood clots that may form in the capillaries or vessels will be passed through the right atrium and ventricle and then be reabsorbed by the lung tissues because of the patency of the septum here. Blood could pass from the right atrium directly into the left atrium and left ventricle and be ejected via the aorta. So blood clots could bypass the lung reabsorption and be passed straight onto the brain. This would result in acute ischemic stroke. So if risk factors such as atrial fibrillation or if a patient possibly has other surgeries scheduled, the ASD may need to be closed to prevent possibility of stroke. So some risk factors for ASD include preterm delivery. If the septum purely has not had time to form, it could result in atrial septal defects. Family history of ASD also indicates that it's more likely for future children to have the same issue. And children born of the male gender are 4 times as likely as females to have some form of ASD. So ASD can vary in the size and shape. Most patients that have an atrial septal defect will be asymptomatic. Small septal defects may close on their own, similar to the patent foramen ovale. So it's likely that only medium or large septal defects will show symptoms. And those symptoms may include heart murmur, could result in an irregular heart rate, shortness of breath due to the inefficiency of the blood pumping, or possibly due to hypertrophy from increased pressure, fatigue, and as I mentioned before, stroke. So the treatment options for closure, should it be indicated, the most common procedure nowadays is a closure via cardiac catheterization, and an appliance is put into the hole between the atrium. So the way this is performed is the cardiac catheter is threaded up through the leg. A balloon is used to inflate the hole to a standard size, at which point it's then plugged with the device. This type of closure is only indicated for small or medium-sized defects. If the defect is too large, the plug won't sit properly, and they can't expand it more for risk of complication. So in the cases of large atrial septal defects, heart surgery may be the only option. Following surgery, antibiotics are indicated as a prophylactic to prevent endocarditis, similar to many heart procedures. Patients will also need to be monitored closely for clot formation because the appliance itself could form clots. So complications from surgery occur in less than 2% of patients. So it's a very low risk procedure. So any additional information regarding atrial septal defect can be found on the American Heart Association website or by calling 1-800-AHA-USA1. And that is my presentation on atrial septal defect. Thank you.